flipping through the slides?
Yeah, that was what I was planning.
Okay.
You see everything okay there?
Mm-hmm. I can. How quickly do you want to get started at 1? Or at noon, your time?
Well, some of us are in Eastern. Well, I'm not, but I guess half of Tennessee is or something like that. Maybe not half. I don't know, a minute or so. Just give everybody a minute or so to get settled in.
Sure.
And then I'll start jabbing. Welcome everybody who's here already. Thank you for being early and or on time. Given that we are all learning things about technology, I suppose offering a couple extra minutes for people to get into the room makes a little bit of sense. So. So we still have some folks coming in at this point. So maybe give it a couple more minutes. For those of you who are here, we have an introductory slide on the screen. I'm hoping everybody can see that. That explains a little bit about the room etiquette. As you've probably noticed, everyone is muted upon entry. That helps with feedback problems and getting a lot of excessive background noise and things like that from happening. I say all this because it's also relevant to teletherapy. So sometimes it makes sense for people to put on headphones or to mute and unmute themselves as needed, depending on the environmental situation that they're in. So one thing that I'd like to address at this point, and again, I might repeat all of this in just a second for those who are trickling in. Somewhere on your screen, you should have the option to select either a thumbnail view, possibly a grid view, to see video of the people who are on video. And what I'd like for everybody to do, if you are on video, is to find yourself in that grid view, and just make sure that you are up to speed on camera angling, and that you like the background that is there and all of those things. Again, this is great general advice for teletherapy as well. We don't want anything to be on screen that might, show private information about us, or, we want to be mindful of what is visible. So anyway, do we still have folks coming in? Should we go ahead and get rolling?
Sounds good.
Okay, well, so I am Elise Oring with TPA. Thank you everybody who's here already. I appreciate you attending. I hope that you find today's presentation helpful. So at TPA, we were over in DC doing some good work for our field last week or the week before, whenever that was. And when all of this stuff started happening, we thought, it might be a good idea for us to put together something to help facilitate you all in practicing teletherapy. A lot of folks have not been practicing teletherapy before this, these chain of events that have happened over the last couple months. And so we want to provide you with the resources necessary. We don't have all of the resources. Obviously, there's a whole lot of things out there, and a lot of things are changing on a day-to-day basis. And I want to acknowledge and recognize, first of all, that even those of us, and I guess I can't speak for Trevor and Jeff, but I, as a presenter, even am, or co-host, whatever my title is, I'm overwhelmed myself with the amount of information that we're having to keep up with regarding changing laws, what we can do, what we can't do, and how we can best serve our clients. And so we're kind of all in this together. And so I want to just acknowledge that and normalize that if you're feeling anxious about these adjustments, that we all are. So as for room etiquette, everybody, again, is muted upon entry. That way we don't have a whole lot of background sound and stuff. When you get a lot of people into a room, it can be very distracting if there are dogs trying to join in on the session, or, you've got the news playing in the background, or, even just picking up your coffee can create sound and distractions. So everyone is muted. And we also have a chat box function though. So somewhere on your screen, you should be able to click on the chat box to open it up. And we'd like to invite people to send questions directly to the host. So these questions are not going to be visible to everybody initially, but when we get to the Q&A section at the end of the presentation, we can sort of go through those in an organized fashion. And I think that's it as far as room etiquette. Did I miss anything? Okay. Also, just to reiterate, you want to make sure that you check your camera angle and stuff if you're on view. Last time we did this presentation, I didn't know that I was even on camera. It took me a second to find myself, and I've been using Zoom for quite some time, so that was fun. Anyway, all right. So we invited Trevor and Jeff to help present this information to you all because they have been in the telehealth, teletherapy world for quite some time at this point. They've worked on putting together their own software company, and then they also have a private practice that is, and correct me if I'm wrong, but hybrid, both in person and a teletherapy practice. And so this has been their gym for a while. And so they really are some good folks to be able to speak about the nuts and bolts of things from both a clinical perspective and from a technical perspective or technology-based perspective. And so, you know, we just felt like they were a good couple of guys to come and chat about all of this. So without further ado, Jeff and Trevor, take it away.
Thank you. I just want to start by saying I appreciate everyone's time. I know that this has been a really abrupt change to the way that we've been practicing. And I'm guessing for most of you, whether you've tried teletherapy in the past or are just starting, we're now really being expected as clinicians to take this on full time, at least for the time being. And so as I go through the presentation today, like Dr. Oring mentioned, I am a clinician. I've been in private practice since 2010. Was part of a large group practice for several years. And then Trevor and I started the first teletherapy practice in the state of Michigan back in 2016. Around the same time, we started this mental health EMR software company. And so when, like Dr. Oring mentioned, when there are questions about how this looks in practice or how this looks from a technology standpoint, we'll do our best to answer those questions. Our group practice in Michigan is a small group practice of local clinicians. We do see people throughout the state using teletherapy. And at this point, we are a hybrid practice, which means that we have clinicians that see people locally in person, as well as do teletherapy with individual clients around the state. So before I got started in teletherapy, I started consulting with the American Psychological Association for about a year because I felt so uncomfortable with the laws and regulations, the way that they were written for the state of Michigan. It was still pretty much the Wild West, and there wasn't really any restriction on anything that anyone was doing. And I didn't feel necessarily comfortable with that for my clients. And so spent a long time consulting with them to come up with a protocol on how to do teletherapy. So I've been almost exclusively teletherapy for about the last 4 years now.
Hey everybody, I'm Trevor. I'm going to be kind of thumbing through these slides back and forth a little bit. I've got one single screen, which I'm not used to. But I actually started out in technology, and Jeff and I met actually over my internship, crossing over into the social work world at a old private practice that he and I used to work at, respectively. We just really saw that there was a need to do things ethically speaking when it comes to teletherapy. There's a lot of things that were there that did exist that I don't believe were being utilized the right way. And then there were a lot of things that weren't, necessarily in place for us. So kind of a little bit of background about the two of us. And we'll go ahead and move over to the HIPAA compliance here real quick. And just kind of conflicts of interest too. Jeff and I kind of need to talk about this up front. We do own an EMR, EHR company called Therapy App. It does have a video platform, a lot of other good stuff, but we're going to kind of stay away from that. But we do need to let you know, just there's a conflict of interest there. And then obviously our teletherapy group practice as well.
And just as we go through these slides today too, when we're talking about teletherapy, I don't see teletherapy as a replacement for traditional therapy. And so as we go, I've been doing it for quite a while and I can answer questions, but also, I know that this is kind of a stopgap measure for most of you. And so we'll be covering kind of the basics and just the how-tos and some of the legal things and especially kind of the HIPAA privacy situation that we need to abide by as clinicians. But if you could take a look on the screen, as an adult, college-educated, straight, white, middle-class man, I understand that my experiences are my own, and I pledge to do my best to welcome the experiences of others by listening and learning from them. As we spend our time together today, I hope that this place is where everyone is free to share any and all experiences as a valued addition, and I truly mean that. And so, whether you've never picked up a computer to do teletherapy or whether you've been doing it for years, I want to make sure that all experiences are validated, and also the fact that I want to draw attention to my experiences are my own, and I understand that we all have our own unique sets of experiences as well.
And if I could just add to that, Jeff, real quick, there's a very broad range of experiences, even in this room. Some people who have never used technology at all in their practice, you know, maybe this bottom end over here, you know, not necessarily bottom, but this end over here. And then on the other end of the spectrum, we've got folks in the room who have been practicing teletherapy for some time. And so you might have more specific questions, you know, related to, you know, the ins and outs of it. And so just bear with us, because there's really a broad range of experience that we're trying to cover in this presentation.
Dr. Oring, I can appreciate the fact that there are clinicians probably in this room right now who have been doing things in their own way for decades. And so when we're talking about teletherapy, I don't mean for it to sound like the preferred method for all of you. I just want to make sure that you all feel comfortable knowing how to do it as we're all kind of forced into this situation together.
Okay, so here's just kind of a little run through of kind of what we're going to go over in these slides. If there's any additional questions, please let us know at the end, because there's a little Q&A for all of us that we'd be more than happy to go through once we're concluded here.
So what is teletherapy? Basically, teletherapy is the ability to meet with someone from one location, meeting with a client in a remote location using technology. And so as we go, I'm guessing that there will be questions about telephone sessions or video sessions. And those are questions that are probably more directed to the TPA and those who know specifically about Tennessee state law. Trevor and I can speak to Michigan law, but I understand that that doesn't apply here. And so we want to be able to direct those questions to the TPA. Teletherapy can be called several things, and I know that, you know, there's probably several words going around in chat groups that you're in, or just knowledge or information that's been presented to you. So teletherapy is known under several different names, but generally the same concept. So here's just a list of places that have traditionally been covered for teletherapy. The insurance companies are loosening their regulations day by day as we speak about what is covered. But traditionally, these have been covered using teletherapy services. So the history, I know that technology for some people feels threatening, and especially the change in the way that we're expected to do things now. And just the evolution of technology, even within psychology, has been around for several decades. I mean, psychologists doing phone sessions as early as the 40s, started emailing their clients back in the 90s, and now we're up to where we can communicate remotely through a secure HIPAA compliant platform that allows us to see our clients' face on video. And even into the future, there's probably going to be VR stuff, but I don't want to scare anybody. So people have been kind of freaked out by technology ever since it's been around. I mean, even in the early 1900s with public cinema, it felt threatening to the way that families operated and the way that communities operated. And ever since then, there's kind of been an evolution with technology. But I think when some of these things come around, especially for the first several years, it does challenge the norm. And so I can understand that this may feel threatening or really different from the way that you've traditionally practiced. So as we go, some of the things from this short little vignette, we will be able to answer here pretty shortly. But if you could just take maybe as long as it would take you to read through this and see if we can remember some of these things, but also I'll be addressing some of the issues in the vignette as well.
And hopefully as you read through this, you are drawing up some of your own experiences that are currently coming up for you. You know, questions that you might have had in the very recent past. You know, this may have been an uncommon situation just a short while ago, and now everybody's facing a lot of these questions today.
Sure. Okay, Trevor.
So current Tennessee laws. So with regard to Tennessee laws, I think that we have Pam on the line. Yes, Pam, maybe. So we've been trying to communicate with our Board of Examiners to stay up to speed as much as possible on our laws. And at this point, there have been some statutes that have been pushed through, but are kind of in a waiting pattern, a holding pattern at this point. And so the teletherapy laws that govern psychologists are not super duper clear. And so Pam, I think that you can probably speak to that more clearly than I can.
Yes.
And oh, yay. Hi, Pam. I can see you.
Yeah. Yes, the Board of Examiners was given the authority to regulate telepsychology in 2014. So we have that in the statute, and that means that psychologists can see people and do they can do this work. The Board of Examiners came up with a set of rules in 2014, 2015, and they went into internal review. And when they went into internal review, they've never come out. They came out in 2018, and some questions were asked by the government about these rules. And the people on the board in 2018, there was no overlap with the people that were on the board in 2014. So it was an interesting meeting because no one knew the background of it, and even the board attorney. So they've gone back into review. Recently I talked to Jennifer Putnam, who's the acting board attorney, about what has happened to these rules. It'd be a good time to have rules. And she said that in fact the rules are still in review. She's been acting because the real board attorney has been on maternity leave. She comes back next week, and she said that she will ask her to get in touch with me about the status of those rules. But as of now, psychologists can do telehealth. We are mandated by, the general rules to do therapy and to keep records in ways that are compliant with, with our laws. There are some general laws about telehealth, about that insurance is required to cover it, that if it meets certain criteria. But I think, as Elise said, that criteria has been loosened recently by the governor. There's also some rules that say that telehealth is not, or some laws, some statutes that say telehealth is not a new standard of care. And so the rules and laws regarding telehealth cannot be more restrictive than the rules and laws that are in effect for in-person meetings. So that's kind of where Tennessee is right now.
And so thank you, Pam, for helping expand on that. If anybody has any specific follow-up questions or anything, that chat box is there for you to plop those questions in there, and we will get to those toward the end.
Here comes my fun slide. So with the insurance and billing, there is a lot to cover and a lot of things to kind of consider. Now, definitely check with your malpractice insurer to make sure that you have the correct rider on your insurance. A lot of folks will get, liability coverage and won't realize that teletherapy may or may not be included in the verbiage. So make sure that you talk with your insurance agent or whoever you have your insurance with to make sure those things are set up properly. Think about things like, do you require, supervision, and how those kind of reflect in the billing respectively, and how to actually send billing out. Now, the insurance reimbursement and billing specifically, there are modifiers, prior authorizations. There's a lot of things that are different per provider and always have been. For example, priority would require a pre-authorization for you to be able to even start teletherapy. So my recommendation is, whoever you are paneled with, make sure that you reach out and see the policies that they have specifically to those insurance companies as to how to start teletherapy. Some are more relaxed than others, but definitely take a look ahead of time to see how that goes. I've got a couple examples on here. I'll try to bring them up. I had a little trouble last time, but I'll bring those up here in just a second. There are trainings available, which is super helpful, both virtual from your insurance companies respectively. So if you've set up a portal and you do have an inbox that you don't look at like I do, go ahead and look in there once in a while, because they do send out trainings periodically, or have virtual trainings that are pre-recorded, which is super helpful. Insurance representatives are in the area for us in Michigan. So I can actually reach out to somebody for Blue Cross specifically that is an area rep that can walk me through questions and concerns. Sometimes they offer in-person trainings as well, which is super helpful. And they're just a great resource in general. And then of course there's online resources as well for each of these companies respectively. So go ahead and make sure that we check those. Now this works correctly. Awesome. It's gonna pull up for me here. No, maybe not this time. Sorry about that. So for modifiers, I'll just briefly cover those. So for example, with Blue Cross Blue Shield, require a GT modifier, and then for you to change your location code, which is typically like 11 for an office visit, you'd be switching those to like the number 2 for teletherapy specifically. Now, I say this as far as check with them individually, because that's not the rule for all of them across the board. Some of them have different types of requirements, and even use different CPT codes now that they've updated recently. So it's not necessarily just the same, 90-minute, 60-minute sessions anymore. They're moving over to teletherapy specific codes. So go ahead and check into those, and it's a fun world to dive into.
So the APA guidelines, this is actually, these are actually pretty old, and they still apply. So these came out in 2010, and this was after they had put a committee together for telehealth. And that's when really good research started actually coming out of the APA. So even things back from around 2010 on are still really relevant and good information. The first guideline is competence of the psychologist. So basically it's taking steps to make sure that you are competent with the software that you're using, and also making sure that you're competent enough with the software that you're using so that you can answer questions for your clients. So if you've recently signed up with a video service or an EMR system that has built-in video, you just want to make sure that you're adequately trained, especially before kind of jumping into the deep end with your clients. Clients will have kind of how-to questions about how to use their software, and it's good that you have that information ahead of time. And so my suggestion is whatever system that you're using, make sure that you go in and play around with it quite a bit. Go in, set up a new client, use an email address that is maybe for you so that you can actually see how the client would walk through the system as well. So if it's a system that sends out an email, you'll know what that looks like. You'll know what your clients need to click to get their account activated at that point. One of the things also, there's issues with technology. I mean, even since we've started, I've heard a couple of glitches in the sound. And so you're going to have system issues at some point. It's really important that when you're working with your clients that you have a crisis plan set up. So let's say I'm working with a vulnerable client and the technology, my internet connection is bad for whatever reason, and we keep getting disconnected. The really important part when doing teletherapy is to kind of set the guidelines with your clients up front. So spend the first 5 or 10 minutes of your initial session with them online, walking them through the software, walking them through an informed consent that looks different from an in-person informed consent, letting them know about some of the issues with the technology, so that if you're getting disconnected from your client, that you might have a backup plan of, I'm going to call you over the phone immediately if that happens, or we can try and reconnect through the software, but I will also follow that up with a phone call just to make sure that we stay connected. And
Jeff, one of the things I'll mention, like you kind of said there, we become the first line of like tech support, for lack of a better term. So getting to know the technologies too is just something that's going to inherently happen. You know, different browsers, different types of technology, all of these things work differently. And if you have any questions, feel free to reach out to us as to how to go through those barriers too.
Sure. So I get often, I'm often asked the question when I do trainings or speak to people about teletherapy, how can you build a relationship with someone online? And for most of you in this situation, what we find ourselves in now in response to the public health crisis is that most of you are going to be seeing your existing clients anyway using teletherapy. So these are people that you've probably already had a pre-established relationship with. And once they get connected to the software and start using the video system, you'll notice that very quickly people feel comfortable with it. Over the course of time, I've made several adaptations to the way that I do things in practice. One, you know, I often hear from people, well, how can you read nonverbals from people through the computer? And so what I've done in my office is I actually have like a 40-inch TV screen on my wall, and it's connected to my computer. And so they show up really large on my monitor. And so what I do is ask them to set their camera back a little bit so that I can see their full body. Now, if you're doing it over a laptop or a tablet or something like that, you probably won't have that luxury just because it'll be too small on your screen. But I think one of the things that you'll notice is that people very quickly feel comfortable with it and kind of jump right in, especially after you work through those, you know, initial stressors of just getting connected to the video for the first time. So the standards of care, this has more to do with professional standards that we abide by just as clinicians. And so when it comes to the ethical and professional standards, they're very similar to what we do in person. We use HIPAA compliant means to meet with our clients. Now, the difference is when you're doing teletherapy, one of the things that you'll have to keep in mind is that you'll want to do kind of a continuous assessment of people's safety. So when you're meeting with people on video, it's extremely important that at the onset of each session that we ask our clients what their physical location is. And I can't stress this enough, because let's say there's that 1 in a million chance that they have a heart attack during session, or there's some other sort of emergency that happens. We want to be able to call the proper authority and let them know the physical location of our clients. If we're not aware of that and an emergency happens, I can't just call an emergency professional and say, I have a client who's having a situation and I have no idea where they are. So please make sure that you know the client's physical location. And it might sound kind of weird just to ask people, like, are you at your home? Are you, you know, at a cabin up north or something? Just to be able to make sure that you have their physical address. Now, one of the other things to keep in mind when you're assessing people's environment is it private? So when you're meeting with somebody, even in their homes, are they in a private space? Because there might be a situation where people have paper thin walls, and even though they're behind a wall, the people in the next room can hear what they're saying or what you're saying as their clinician. And so just to make sure that it is a private area. And over the course of the 4 years that I've been doing exclusively teletherapy, I've met with people in all kinds of different locations. So I've met with them in their car while they're waiting for their child's soccer practice to end. I've met with them in their offices. I've even had situations where people didn't have any privacy in their homes, and the only place that they could be private was sitting outside of their home, whether it be on their porch or in their backyard. And it's just a situation where you have to assess as you go, are there other people around? Can people hear what we're talking about? Is this still private? Because if it's not, I have to inform my client that unfortunately I can't maintain your confidentiality the way that this is set up, just because other people might be present. So one of the things that we're finding ourselves, we're asking ourselves really is teletherapy appropriate for all of your clients? And I can't answer that for you. I can only answer that for my own. And depending on the relationship, depending on the presenting issues of your client, it's up to you to make that determination as to whether it can be a benefit for them, or if there are potential downsides that outweigh the positives. Now, a question I often get asked is, are actively suicidal or people with active suicidal ideation, are they appropriate for teletherapy? I can't answer that for you individually. I can just answer it for my own practice to say, I assess the situation as it comes up. And if I'm the only means to be able to access care for someone in my community, I consider that as a way to make that determination. Because oftentimes I'll even see people with active suicidal ideation, because if we weren't having access through teletherapy, they wouldn't have access at all. But this is a kind of an ethical question that comes up frequently. And I just want to make sure that I'm not telling you one way or the other. I just want to make sure that you know the relationship that you have with your clients, and to make that determination on an individual basis.
If you need any help connecting with resources too, Jeff and I would be more than happy to provide those for you.
And we're providing the slides from this to anybody who wants it as well, Dr. Oring?
Yes.
Okay. So when you set up the environment at your house or your home office or any other private place that you choose to see your clients during this time, you want to make sure that the environment is set up correctly. So make sure that you have proper lighting. The lighting in the room that I'm in is not great. And if I were doing a teletherapy session with someone, I would make sure that I had proper lighting so that they could see me. That the sound quality is good. Some people like to use kind of Bluetooth headphones or microphones. Sometimes there are issues with people's technology in terms of like Bluetooth or plug-in headphones. And so generally, if they're using a laptop or a computer, I encourage them to just use the microphone on their computer or on their tablet, just so things don't get lost in translation of trying to use some Bluetooth device or some alternate device to be able to use as a microphone. The proper distance from the screen. So whatever video service you're using, like I said, you'll want to try it out ahead of time and make sure that your clients will be able to see you. Generally, most video systems have like a little in-screen box that allows you to see yourself. And so when that happens, just make sure that your camera is angled properly so that people can see you and so that they feel connected to you. Because, sometimes when I connect to clients, their angle is, I can see maybe the top of their head and their ceiling. And so as a therapist, I have to let them know, hey, I just need you to re-angle your camera so I can see you a little bit better. And these are issues that you'll see pop up pretty frequently as you go. As a clinician, though, when you're doing things from maybe a home office or a location that's different from your physical location that you've been practicing out of, you want to make sure that you don't really have any personal identifiers in the room like Dr. Oring mentioned earlier. So I don't even know if this is a thing. I'm not an arborist, but if you had the only black walnut tree in the state of Tennessee, please don't sit in front of a window with that tree behind you. It would be a way to identify your location. And at that point, it just, it's more of a liability at that point. So just, make sure you don't have like a big map of your neighborhood or something behind you on the wall, because that would indicate where you're at. Make sure that when you're setting up your space that I believe it's applicable in the state of Tennessee as well, but having your license posted somewhere in your office. And so even if you're working out of a home office, try to get a copy of your license, or at least document the fact that you've given your clients your license number just in case they ever, needed to make some sort of legal claim that we're giving them the ability to do that. Make sure that your office location is private. I don't know if any of you remembered the old the BBC interview that happened maybe it was about a year ago now, where the guy was giving an interview and his son or daughter busted into the room, And so it's one of those things where there are certain environmental factors that we really need to account for when we're doing these things. And I can't stress enough, I know it's kind of a joke, but please wear pants when you do teletherapy. It is not a thing. I know it's a joke to go pantsless. You are a professional, and if an emergency situation popped up and you had to stand up, we just want to make sure that we're covered literally and figuratively. So there's that.
You only say it because we have to, right, Jeff?
I'm not telling you what kind of pants, but make sure you're wearing it. Yeah.
Just want to make mention too of a couple things. So how video transmits, also be aware of like bright colors. Like the things that I'm wearing actually have a little bit more of a difficult time traveling, just due to the megapixels and how information travels via video. Also, super bright environments are a little bit harder too, and then like motion. So the more that you're moving around and doing things like this, like the harder it is for actually the video to stay connected properly too.
And I would say the movement, Trevor, is probably, I see that more on the client end. So when you're meeting with clients, they might be moving around, or since they're in their home environment, they may be, fiddling with things in the room. If we could just encourage them to sit and talk to us, it actually does affect the video quality pretty significantly when people are moving around quite a bit.
Yeah, I was going to say a couple of things about environment as well. So I don't know that people are as aware that movement and lighting can affect, excuse me, can affect quality of video. But, take note of that. And then I also, so for lighting purposes, having a light in front of you as opposed to above you or behind you makes a big difference in how you are being seen. And so I can give a couple of examples of that. So movement on my part, see how that changed the whole lighting, and then that alters the quality of the video as you make movement and motion, because it's trying to adjust for the lighting. But then I can also give another example and just turn around and have the window behind me, and now you can see nothing of me, right? So just be cognizant of that when you're on video, and then also making sure that your clients are aware of those things as well. Now, I will also, and we'll speak more on confidentiality, but it kind of fits here too with the environment. Sometimes I'll have clients or offer or ask them if they're willing to spin their camera around to ensure that they have a private environment. And then I might offer to do the same thing, just spin my camera around and say, here's the room I'm in, here are the doors, they are closed, no one else is here, you can't, so you're not going to be heard, you are in my headphones, therefore no one can hear you speaking. And especially I think that a lot of folks might be at home with their kids right now trying to do sessions. What do you do with your kids? How do you keep them out of the room? And a lot of that stuff, I think, you can just be frank with your clients about it, especially in times like these. Like, I have kids, they can't go to school. And so they are locked in another room, not in a closet, whatever. Anyway, I've done my due diligence to try to keep them from busting in on our session or overhearing our session, but they're kids. And so what can you do? So that's just a couple of comments on that.
So informed consent, this is kind of a big one. And the reason I say that is because we're taking things from our in-personal traditional practices and moving them online. And so there are differences in the way that we need to inform our clients of some of the potential risks. So when we're using an informed consent, we want language in our informed consents that speaks specifically about the potential downsides to teletherapy, some of the vulnerabilities, and also speaking directly to the software that we're using, whatever kind of video that you decide to use as your platform, you want to make sure that something is in your informed consent talking about how that video kind of works. And so when we start talking about video risks, we're talking about making sure that people understand that they're that anything put online is basically in some ways vulnerable. There are certainly varying degrees of compliance and encryption, and we can get into that in a minute, but we just want to make sure that our clients know some of the downsides or potential risks to using technology. And I know I've seen a lot on Facebook recently about people kind of asking for other people's informed consents. If you ask for somebody's informed consent, just make sure that it's personally tailored to your practice, just because every informed consent is going to look different, and the way that you operate might be different from the practice next door. And so just make sure that your own language is in there so that you're covered. Use common language so that your clients can understand. If I start talking about levels of encryption or something like that, I'm going to lose a lot of people. And so just making sure that there's common language in there so that your clients are fully informed. Hopefully none of the platforms that you're using cause any additional charges to be made to your clients. There should be no charge for your clients to use video or to use the software system that you're using. Their copays and deductibles will remain the same as they were, but there shouldn't be any additional charge just because they want to connect to video with you for a session.
Good thing too to make mention when we're talking about informed clients of billing protocol, there's a couple things from the billings perspective that there might be something required of a client when doing teletherapy. So sometimes a insurance company will send out a request for something from the actual client, not necessarily from us as a practice, but they will send us notifications letting us know that we need to reach out to the client. So just making them familiar with that process, that might be something that happens just to create a situation to where you're not having things go for weeks at a time.
So making sure that you're going over your teletherapy specific informed consent during your first session, educating your clients and just letting them know, hey, I know that this is different for both of us. And for most of you, you'll be able to communicate that this is a temporary situation that we find ourselves in. And while we find ourselves in this situation, I just want to make sure that you feel comfortable with the software as the client. And so spending that first 5 or 10 minutes of that initial session online, making sure that you're able to answer any questions for them, going over your informed consent, and just familiarizing them with the video and their environment that they find themselves in. So the confidentiality, making sure that you are aware of the technology companies that you're working with. So looking into their privacy statements and the way that they house your client's information is extremely important. And any company that you work with should be highly visible in terms of what their policies are, and making sure that if you're going to go with a HIPAA compliant software, that they're giving you a BAA, which is a business associate agreement, which protects you in terms of liabilities if, let's say, a technology company ever had like a security or data breach in their system, that they would immediately notify you, and that the liability is taken on by the company as opposed to taken on by you as a practice. So I know that there have been things going around now about whether we have to use HIPAA compliant software or not use HIPAA compliant software. If you really want to cover yourself from a legality and liability standpoint, I would really highly encourage you to go with a HIPAA compliant platform. And even when we're communicating with our clients differently now, if we have to send them emails, just making sure that they and you understand that, to my knowledge, at least at this point, the only free HIPAA compliant email is Gmail. There are several pay to use kind of HIPAA compliant email systems that we can use. But if I sent a client, let's say, an email to a Yahoo account, technically that's not HIPAA compliant and secure enough. I know that these are extraordinary times though, and that's a determination that you make on your end as a clinician and as a practice. Now, there are software companies that have built-in messaging systems so that you don't have to worry about whether their email is HIPAA compliant or not, because that communication is taking place within your EMR software that runs your practice.
Every company that you work with to interface with your client, you would want to have a business associate agreement in place. And that includes even your phone, like even if you, I don't even know if *67 is still a thing, but like even if you call people privately from your phone, if you don't have a separate business associate agreement in place with, say, Verizon or AT&T or whoever, then that isn't technically HIPAA compliant, because that phone number shows up in your phone records, your personal phone records, and that is PHI. And so a lot of people will opt to use VoIPs. Somebody can y'all say that's virtual operated, what is it?
Voice
Help me
over
out.
IP.
Thank you. Voice over IP. There you go. No, anyway, so those are phone systems that you can use, and there are apps and things that you can get that are already set up for these purposes that have BAAs included in them so that you can communicate with your clients securely. And then also systems, EMRs, EHRs, or electronic medical records, electronic health records that you set up shop with, they typically are also going to have a BAA in place. But people don't think about how, maybe their phone does, their phone company like Verizon doesn't default have a BAA in place. All that being said, the other thing is Gmail. In order for Gmail, and correct me if I'm wrong on this, Jeff, but for Gmail, you have to go into your settings and toggle over a switch indicating that you would like to have a BAA with them in order for it to be HIPAA compliant. But still, if your client doesn't have the same level of protection on their end, then we're only as strong as our weakest link, right? I think making sure that that's part of your informed consent, for instance, maybe in your signature line, that they're aware of the limitations is important.
And I think, Dr. Oring, anybody who is signing up for a new software platform that claims to be HIPAA compliant or is HIPAA compliant, it's not a matter of that they should send you a BAA. You demand a BAA. Tell them, if you are HIPAA compliant, I need a business associate agreement, and they should be able to provide you one immediately. So these are no cost to you. And basically it's a written form that just covers your liability when it comes to transmission of your patient health information over the internet. And so anybody who's HIPAA compliant should be sending you that day one before you use the software, and be able to provide that on demand.
And as the
Okay.
HIPAA laws have been changed and loosened, I just want to reiterate that piece about ethics and laws, right? So though it may not be legally required at this moment in time to have surefire, solid HIPAA grounding, we still have an ethical obligation to our clients to do our best and to do our due diligence, right? And so I would also recommend that everyone, document the measures that you're taking to ensure HIPAA compliance during this time. So it may take a few days to get something up and running. And in the meantime, you can sort of document, well, I've been trying to get a hold of Zoom for 5 days so that they can make my Zoom HIPAA compliant, and, waiting for further contact, or you get what I'm saying? Just document the measures that you're taking and, with regard to due diligence.
I'll say as well, be aware of the BAA and what it says, because there's actually verbiage in there that if something happens, who is your policy officer with your practice? And if it's you as a single practitioner, that would be you. And having plans and things in place of what to do if things get breached in any way, how you're going to go ahead and make aware clients that would be affected. Just make sure that you have all that stuff in place as well.
And I know we're covering a significant amount of information, especially for those of you who have never done this. And so I would like to offer as well, after this training, if you have questions about teletherapy in general or what HIPAA compliance looks like or software, I know that Trevor and I could speak for Trevor, we'd be happy to answer any questions that you have, just because we've been doing this for several years now, and have some background in it. So if you have any questions other than just getting the slides to the presentation, we're always available to be contacted as well.
And we do have, a few questions out here as far as like the Q&A portion here. We're getting to that real soon here. So just hang in there with us and we'll be right to that.
And we can skip this one, Trevor. So Aunt Joe, this is a short vignette that discusses some of the issues that might arise when it comes to insurances, or whether it comes to some of the ethics or just in practice of teletherapy. So it used to be one of the issues in this was that she was on straight Medicaid. The laws, at least in Michigan, have relaxed in terms of Medicaid and Medicare. In the state of Michigan, we're actually able to provide therapy services using teletherapy to Medicaid and clients who have Medicare as well now. She also has issues with transportation, so it might be a good fit for her. Even though her children are disruptive to the home environment or the therapy environment, that she can still potentially meet with you in the privacy of her front porch. And so that's just another issue that as you go, you just determine whether it is truly a private place and whether it would be appropriate for you to meet with her. Explaining to her that the software is not your own and that it is another company that you're working with, but also that you have a business associate agreement and that they have privacy measures put in place so that they can be HIPAA compliant. The other issue is the communication about having a partner with domestic violence issues. So this comes up a lot in my trainings pre-coronavirus, is when we're communicating with our clients, we just have to make sure that whatever means we use still maintains their confidentiality and their privacy. So if I'm emailing someone about therapy, and they have a partner or someone else with access to their phone, suddenly that partner or that other person has access to their email and their text messages as well. So just be aware that whatever you're communicating with your clients could potentially be seen by someone else, unless you're using a piece of software or an electronic medical record system that has messaging built into it, because that adds another layer of security that would require another login. Go ahead. Oh, okay. So this is part of the soapbox that I could go on for a long time, but I won't. But making sure that the companies that you're working with for video or for an electronic medical record system, they're never selling your clients or your information to third parties. That information stays with them. They're not using it for any advertising purposes or anything like that, and that their data is being transmitted securely and through what's called encryption. And encryption is basically kind of a code that's put on the data as it travels from your device to their device. And the level of encryption is really important, just because clients are sometimes worried about systems being hacked and things like that. But a lot of the HIPAA compliant softwares out there now have kind of bank level encryption, and so that they are HIPAA compliant and they would be nearly impossible to hack real time. So the disposal of the data, just making sure that your companies have a policy to maintain your records for as long as you legally need to maintain your records. So, 7 years or post 7 years after turning 18, theoretically, a company could be holding on to that data for 2 decades, let's say. and just making sure that there's a policy in place that they maintain your records for that long so that you're not out of compliance at some point. So the business associate agreement, the potential downfalls, again, making sure that these companies are not selling your or your client's information to third parties, and that they are HIPAA compliant. Just because if you're using a system that's not HIPAA compliant, the laws are a lot looser, and their ability to share information is exponentially higher. And so if the company that you're working with isn't HIPAA compliant and they're sharing your client's information or your information for marketing purposes, that could travel through several different companies selling your client's data, and it's just a bad situation to find yourself in. Making sure that when you get on board with a company and you're putting your client's private health information in, that if you ever want to leave that company, that there is a policy to take your data with you. And this should be covered in the agreements that you have with your video provider, your EMR provider, that basically says, if I no longer want to work with this company, how do I take that information and move it somewhere else? And so just making sure that they don't have a policy in that makes it really difficult or very costly for you to take that information, because then it makes people feel stuck sometimes using a system that they no longer want to use. And just assessing, I know that this is like a stopgap measure for a lot of you, and I understand that it's a need right now because of the public health crisis. But when you're looking for a piece of software, you want to make sure that it's meeting your needs right now, and that it can meet the needs for you and your clients in the future, just so that you're not causing a lot of disruption if you decide to move to another system or figure that you have more needs in the future. So right now, there are a plethora of different uses for technology that I've heard therapists talk about at conferences, at trainings. And one of the suggestions that I really want to make to all of you is that if you're going to make a recommendation for, let's say, even like a meditation app or a food journal or any of the other various uses for technology, that you're really aware of those companies' privacy policies as well. And if I were in a room with all of you right now and I said, please raise your hand if you've given a recommendation for an app to use with a client, I would probably say that a majority of you would raise your hand at this point, just because of things that we've heard about. I'm not here to scare anyone, but I also want to make sure that any of the recommendations that we make nowadays are backed up by us having some information about their privacy policies and how they store our clients' information. Years ago and still currently, if we were giving a recommendation, let's say about an article or an intervention, we would want to make sure that it's from a peer-reviewed journal. And nowadays, we just have to make sure that it's being reviewed by HIPAA compliance. And so if there is an app or a piece of software that is HIPAA compliant, those are generally safer to be able to make a recommendation to your client. So this is more for, and we can skip through this very quickly, but if you have a website that does payments or scheduling or anything like that, technically you are storing patient health information. And so you want to make sure that whoever set up your website has the right security keys and certificates in place to make sure that you're covering yourself in terms of liability. So there are right now a few large teletherapy practices that are kind of nationwide private practice. Well, I should take that back. Nationwide businesses that connect therapists to clients. And these are more of marketing companies, really. They kind of hire on every therapist. They spend a lot of money in marketing for teletherapy. And then their job is to connect therapists and clients. Where Trevor and I come from, that's called corporate psychology. And we're not huge fans of that, to be honest. I think that there's a great deal of value to having kind of the local mom and pop shop therapy office, as well as the local group practice. And the reason I say that is because we have spent years, and I'm sure that you all will be able to relate. We've spent years building relationships with professionals, with health professionals in our community, with schools. And so I think that there will always be plenty of room for us in terms of traditional practice. It's just one of those things that we have to watch out for nowadays, that there are corporate systems coming in and trying to kind of corner the market on teletherapy and cause a little bit of disruption to the traditional practice. And so hopefully by adding this to your tool belt, that this isn't going to replace the way that you do things by any means, but it's certainly an asset. In Michigan, there are nights that we get 10 inches of snow overnight, and traditionally we've had to cancel all of our appointments for the day. Teletherapy allows us to not lose out on being able to see, several clients in a day, that we can just meet with them while they're in their homes, to increase access to care. Because at the end of the day, that's really why I got into this, and I know Trevor feels the same, is there's just such gaps in care for people. And so we saw teletherapy as a way to hopefully reduce some of those gaps and just increase the access to care for people in our communities.
I'm going to try to open things up and just kind of skip through kind of the rest here and just kind of skim them so we can do a little bit of Q&A while we still have everybody here. Testing and assessment, feel free to reach out to Jeff and I. There are, certain things that we kind of cover with this of validating measures and things to that degree. I'm going to go ahead and unmute everyone here. So if you could just do me a favor, because the controls will become yours as well, and you're able to mute yourself after I unmute everyone. Go ahead and mute yourself if you don't have a question so we don't get the feedback, and that'd be really appreciated.
The last thing I want to cover really quickly, Trevor, is the interjurisdictional practice. So if you're just starting out doing this, if you're licensed in the state of Tennessee, you can be physically present in any U.S. affiliated territory. Your client needs to be physically present in the state of Tennessee. So if your clients are out of the state of Tennessee for vacation, or they went home from UT to a different state, you'll want to make sure that you talk to the licensing board from the state that they are physically located in. So if they go back home from UT to Michigan, let's say, you would want to contact the Michigan licensing board and ask if it's okay if you could see that client across state lines while they're at home. So are there questions that have been written out in the chat?
So I've got a couple of them that I do want to address. Do insurers pay when patients are in their homes? I feel like that I've read only pay only visits are covered there. Yes, they are covered for insurance companies to pay in. Now, as I said earlier, definitely make sure the panels that you're on, follow up with them and make sure that the policies and practices are in place, that they're able to go ahead and get those things taken care of ahead of time.
4 out of 5 of your porn or of your instrument players decide they're gonna start improvising. And you can't. I mean, the orchestra's got to play from the same sheet.
Alrighty, so I just kind of muted everybody. At the same time, I'm going to allow you access to unmute to ask us questions. So I'm going to just read a couple more here from the text box that's sitting here to kind of answer those questions real quick. Somebody did ask us about the insurance again. You do need a rider put on your insurance to be able to do teletherapy and make sure that you're covered from an insurance perspective as well. Now, go ahead, if you could do me a favor, I do see some of you are raising your hands, that's perfect. And then we can kind of go through and see who has questions.
Hi, I wanted to make a comment on practicing with patients when they're in another state. An easy way to look up what is going on with the other states at this moment is to go on the Association of State and Provincial Psychology Board website. If you look under their moving banner, there is information regarding licensure related to matters in COVID-19. And they will tell you each state which ones have executive orders in place at this time to allow interstate telehealth or practice. So that's a quick and easy way to check each state that you're interested in to find out whether or not you can do telehealth with those participants.
Could you repeat that website one more time? It was just asked in the chat box for us.
That's the Association of State and Provincial Psychology Boards, ASPPB. And they keep that list fairly up to date. But you won't see all states there because all states have not added executive orders to change their practice. Of course, you can go on any state board and look at the laws and rules, and you may find that you can practice for 30 days or a certain period of time. And I think there's links to the executive orders, or at least the information that's in the executive orders from the governors of those states.
Thank you for that. I can bring up a couple of different resources that we have too. Now, for me specifically, what I've been kind of paying attention to is CMS and the .gov websites in general that do have great information that's up to date. And I'm kind of covering a couple of things because someone did ask as well about the current situation of the laws that have been lifted and kind of the leniencies that have been happening. Definitely look at the CMS.gov website. It has a more up-to-date type of information. I believe the 17th is the last time it was updated. And feel free, Jeff, for at least to chime in with more if you like.
The CMS website is for Medicaid and Medicare. And even though one of the distinctions that I want to draw really quickly is that even though laws are kind of changing and being adapted by the day, you really want to make sure that you're following up with your insurance company, just because even though legally you might be able to do something, you want to make sure that you're going to get paid for it as well. And so even if a law says I can practice here or there, I just want to make sure that I follow up with my insurance carrier so that I'm going to make sure that I'm getting paid for that session. Previously, I mean, before coronavirus came around, when people traveled interjurisdictionally or out of state, we would actually call the licensing board and get something in writing from them that allowed us to do therapy across state lines for a brief period of time. Typically, the max was about 6 weeks. But even, it's one of those things where if you want to cross your T's and dot your I's, I would recommend calling the state licensing board of where the client is physically located and also your home state, just to be able to document that you've made those phone calls to make sure that it's okay.
Thanks for that, Jeff. So just throwing this out there, why we have you folks right now, but Jeff and I actually have offered our software for free for a month with no obligation or no sales, anything involved, just to kind of take care of the situation right now and try to meet clients where they're at. So if anybody does need that information, we're more than happy to give that to you.
We just want to make sure that everybody has a HIPAA compliant option at the end of the day. And for most of you, you've all been kind of thrust into the deep end at this point, and really are being expected to practice in a way that you haven't traditionally practiced. And so we just want to make sure that everybody's taken care of. And like Trevor said, absolutely zero obligation, but we figured we'd offer just to anybody who's interested.
Any other questions from anybody else? The slides, go ahead and reach out to one of us here. I believe Dr. O-Ring would be the best one to reach, to get those. But feel free to reach out to any of us with any questions. Not that I'm offering them up to, but we're definitely available for it.
And Trevor, I'll probably stick around in this room for a little bit. So if anybody wants to have any type of conversation, we'll just unmute you. And if you want to stick around and just have more of a chat, we can do that too.
So
Same here.
I
I'm
really
here for a
have
little
one
while.
now where I'm going to have to, that card, I have the card.
All right, so I'm just letting everybody know, I'm gonna unmute everybody. So if there's background noise or anything going on, we can hear you. But go ahead and ask any questions if you like.
No interest in the past year. I think we got $1.20 of interest. So,
This is Jody. Can you
however, it will put me at lower, significantly lower on.
I found it.
you guys hear me?
Yes.
Yes.
Hey, I'm a psychologist in East Tennessee, and I supervise 2 advanced graduate students. They're postmaster's degree students that provide services directly to patients in primary care. And on Friday, they were kicked out of the clinic. So, we're scrambling because our doctors are so dependent on them. And I can't think of a time when I want the physicians to have access to our services more than in that environment right now. It's so stressful. So apparently we're going to have a service called Visuel come in and do our telehealth, and it's supposed to be available like tomorrow or the next day. So I think, in the next week or so, I'll be learning how it works, and I appreciate your review of everything. I had done telehealth years ago, back in the day when we had like the carts and all that stuff, but this is a really helpful review. My feeling is that it would be better for the students to be not necessarily in the clinic rooms, but near the clinic environment in a healthcare controlled setting, where they can still lean on the team members that are with the patients and see the patients while they're at the clinic, rather than having my patients in their homes, having my students while they're in their homes, seeing patients in their homes. I realize that psychologists can do that now. I'm feeling a little strange about having students, even though they're master's level, they're doctoral training students. Anybody want to, what's your feel on that, and how would you handle that?
Do they have their master's license?
They do not.
Okay.
So it's under my license. And again, like right now, they practice in a primary care clinic alongside a physician, pharmacist, and a nurse. And, somebody's suicidal or something crazy is going on, there's 4 or 5 other people working on the problem together, plus they can call me, right? So, but I don't really feel comfortable with them being in their home independently making decisions. Obviously, they can still call all of us. It's just not the same, right?
So I'll leave that to everybody else. Does
I think
anyone
I have
have
a couple of comments. One, I would say, if you can increase the layers of contact that they have to you during that time, like, so if they are seeing someone from home, if you do go to that step, and who knows what's going to happen, right? But if you need to go to that step in order to increase access, just making sure that a supervisor of some sort is accessible during the time that they are doing sessions, and being clear about who they have available to them during those moments, et cetera, et cetera. And then also considering scope of practice, depending on the level of care that specific client needs. Some clients may need to be transitioned to a licensed clinician, whereas maybe less critical patients might be able to stay with a student for that time. And then documenting all of those things, of course, document. In fact, let me just throw out there too that you can document that you've participated in a session like this, you know, to help increase your skills or improve your knowledge with regard to teletherapy. And the last thing that I'll say is that the APA is there. I've seen some conversations across the listservs where there's a push to try to increase the level of care that doctoral level students can provide during this time, again, to increase access. And because we've gotten all about 10,000 emails in the last week concerning all of these things, I'm struggling to find it right now in the listserv. But I can just say that there's a group of folks who are pushing to try to actually grant doctoral level students almost independent practice in a way, you know, still supervised, but just lifting, you know, restrictions that were existent for them prior to this. So
That's very helpful. Thank you.
and I'll try to find that email. Again, it's buried. So if you can send me an email so that I have your email address, then I can forward that to you so that you are up to speed on that.
And I'm really sorry, I didn't catch your name, so I apologize. But my thought as well is, to me, it has to do with a lot of like cost benefit, right? So if these patients or these clients wouldn't have any access to care, if you weren't able to meet with them remotely, are we better or worse in that situation? And so there's the legality part of it, of whether they're able to practice under state law, but then there's the additional piece of if these students aren't providing care to these patients, are these patients able to access care in any other sort of way?
Right.
That's a tough call.
Yeah, it is. This helps a lot. Thank you.
There's a website right now on the APIC APPIC, they have a news article. It's titled Psychology Training and Education Joint Statement. So you might be able to do a quick Google search for that. That is just kind of talking about what's going to happen with training as far as from the clinical side and from the educational side. And so that might be a good place to start.
Great. Thank you.
Other questions, anybody?
I have a text here just says, can she repeat the website? Can you do that one more time, Dr. Arn?
So it's apic.org. So APPIC.org. And the title of the article is Psychology Training and Education Joint Statement. I would imagine there's probably a banner or something on the front page. But I can also, whoever needs it, if you send me an email, I can also connect you to this article.
Feel free, everybody, to post your emails, and you can private message them to keep them confidential, just to the host, and we'll send out those slides to you too, because we don't see your emails just for participating, just as a heads up. But does anybody else have any other questions that's still hanging on?
Or comments, for that matter.
Sure. All right, thanks for your time, everybody. I really appreciate it. If you need anything, feel free to reach out.
Thanks, everybody. Let us know if we can help.
Thank you all. This was great.
You are welcome.
Thank you, Elise. I appreciate it. This is really good.
You're
Thank you.
welcome. Thank you to Trevor and Jeff as well for helping to present. And thank you to all of the TPA leadership. There's still a couple of you in here. TPA leadership for getting this off the ground. So, and also TPA is another resource for everyone here if you have any additional questions. So.
Thanks for having us, Dr. Oring. We really appreciate it, and we're just happy to share, our passion with everyone. So.
Yeah, thank you. I appreciate it.
Thank you.
Looks like Mike's the only one left.
Yeah, I was checking to see if he was leaving us
Hi, Michael.
an email, perhaps.
Michael is our, he's over our CE stuff on the board.
Excellent.
So he's good people, if you can hear me. I don't know if you're typing anything, but I'm going to go ahead and close out the meeting. So thanks again, everybody.
Yeah, thank you. Take care.
Over and out.